Welcome. Myself Dr. P R Bhuyan, Consultant Neurologist, Aditya Care Hospital, Bhubaneswar. I welcome you all to this Fight Against Epilepsy campaign, this Purple Month celebration. Do's and don't during an epileptic attack. If you are having epilepsy, then inform your family members, friends, or people working with you what should be done during an epileptic attack. Or if your child is suffering from epilepsy, you should impart this information to his or her school teacher what are to be done during an epileptic attack. The symptoms of epileptic attack is sudden unresponsiveness, staring look, jerks and twitches, abnormal deviation of tongue or mouth, even wandering, abnormal behavior. These are the common symptoms of an epileptic attack. If somebody is having epilepsy, then don't be panic. Be calm, don't shout loudly. If somebody is throwing fit, just make sure that he should not injure himself. You should remove all sharp objects nearby. You should make sure that he is free from any tight clothing, necktie, tight belt, etc. Do not put anything inside his or her mouth. Do not forcefully try to open his mouth. You may injure your finger or you may block his airway. Do not move the epileptic object who is throwing fit. Once epileptic attack is closed, then turn the patient to one side so that his saliva can be drained and one should not be drowned of his own secretion. Till epileptic attack is ceased, wait there. Sometimes epileptic attacks are aborted within 2 to 5 minutes, so you need not require any medical help. If an epileptic attack continues beyond 5 minutes, then immediately inform a nearby medical team who can assist, or immediately shift to a nearby medical hospital. Thank you. I, Dr. P R Bhuyan, Consultant Neurologist, Aditya Care Hospital, Bhubaneswar, welcome you all to this Fight Against Epilepsy campaign, this Purple Month celebration. Do's and don't during an epileptic attack. If you are suffering from epilepsy, inform your family, friends, or people working with you what should be done if you get an epileptic attack. If your child is suffering from epilepsy, impart this information to his teacher. What are the things to be done if your child get an epileptic attack? Before doing something during an epileptic attack, we should all have knowledge regarding what are the common symptoms of an epileptic attack. Staring look, sudden unresponsiveness, jerks and twitches, abnormal movement of lip and tongue, sudden abnormal behavior. These are the common symptoms of an epileptic attack. If a person gets an epileptic attack, don't panic, be calm, inform what is happening to the people surrounding. Be sure that sharp objects should be removed from the person who is throwing fit or epileptic attack so that he should not injure himself. Make sure that the person who is throwing epileptic fit, there should not be any tight clothing or any tight object surrounding his neck, remove necktie or any tight clothing. Do not put anything inside his mouth or do not try to open his mouth forcefully. Do not disturb the object while he is throwing fit. Turn the object to one side after seizure attacks are aborted so that saliva and secretion from mouth can be drained and airway will remain open. Stay there till person cease to throw fit. Sometimes seizures may persist beyond 5 minutes. In that case, you have to take the help of a trained medical person. Usually, seizures are aborted within 5 minutes and it doesn't require any medical help. Anyone can have epilepsy. No age is immune to epilepsy. So, epilepsy is a treatable disease. There are a lot of stigma in the society regarding epilepsy, that it is contaminated disease. It spreads by touching the patient. Is it not like that? बस इतना था. If you have epilepsy, you should instruct your family, friends, and people working with you about what should be done when you suffer an epileptic attack. Also, if your child is suffering from epilepsy, you should impart this information to his teacher. What should be done if your child gets an epileptic attack? Learn to recognize some common symptoms of epilepsy. Staring look are the common symptoms of epilepsies. Important first aid steps are: keep calm, speak slowly to the patient who is throwing epileptic fit. Don't panic. Tell what is happening to the people surrounding the person who is throwing fit. Remove any sharp object so that the person should not injure himself or herself. Do not put any hard object or anything to his mouth. Do not forcefully open his mouth. Do not put any water on his face or mouth. Wait till the epileptic attack is stopped. Usually all epileptic attacks are stopped within 2 to 3 minutes. So you did not take any medical help. Stay there till epileptic attack is stopped. Once the epileptic attack is stopped, turn the patient to one side so that his saliva or secretion from mouth will be drained and airway will not be blocked. Do not give any water or anything orally until the patient is fully conscious. Sometimes seizures attacks are prolonged beyond 5 minutes. In that situation, you have to take immediate help of the medical person in order to abort the seizure attack. Nowadays, there are a lot of stigma in people regarding epilepsy. They think epilepsy is a inheritable disease. Sometimes it's spread by touching the patient, so people don't come to help a person who is throwing epileptic fit. It is not like that. Epilepsy is treatable like any other disease like hypertension and diabetes. Anyone can have epilepsy. Let us fight against epilepsy for a better and healthy world. Thank you.